Welcome back to Addiction, Recovery, and Mental Health, a podcast by Waismann Method Opioid Treatment Specialists. I'm your co-host, Dwight Hurst. I'm joined today, as always, by Claire Waismann and David Livingston. May is Mental Health Awareness Month, and there's a lot going on at Waismann to promote that. You know, we tend to put everything in a question format, and I guess the question in this case would be, what is awareness, and you know, how do we increase it? We can touch on a lot of different facets when it comes to mental health awareness. But it's a big time. It's a big focus right now for everybody at Waismann, right?
I think for everybody in society, period. You know, I think especially in the United States right now, mental illness is just snowballing and affecting every part of our society. And so having May as the awareness month, you know, gives us the opportunity of talking about it and, you know, letting the people know that mental illness is treatable and there is help out there, and there is no reason for anybody to suffer alone. Mental illness has nothing to do with who they are, their personality. It is, you know, often chemical imbalance or, you know, a combination of issues that is treatable, you know, and can give you a much better quality of life than you're having right now. So reach out. That's all. I think not just those suffering from it, but those working with it can create some awareness in education. I think is really important. I think if people understand, you know, the roots of it, there's going to be less stigma, less shame involved with seeking help.
I was reading just recently about the increase in depression symptoms and depression disorders. In particular, this article was talking about amongst young people, and it addressed this thing where it said, although it's an activating factor, the pandemic and all the attending things, it's that we may tend to overestimate that there's a rise in depression even before that, and that there's lots of components. I know we have talked on here before about like kind of social media and things like that can be agitators, but to a certain extent, it's just this feeling of, wow, you know, it's on the rise, and mental illness is something that is becoming, you know, it's something that as we talk more about it, we become more aware that it affects everybody who's listening out there, whether or not we have a biased sample with our audience, but anybody, whether they're listening or not, really, if you know, and if you're paying attention, you got someone in your life who has some mental health struggles. And then not to mention the situational depression and trauma that many of us feel, you know, as we recently talked about crisis and things too. So there's a lot going on with our mental health. It really affects everybody.
It does. And I think there is a tremendous amount of misunderstanding in the topic, you know, that I think the more we talk about it, the more people understand about it, the more I think we as society will realize the need for more accessible mental health care, period, for society as a whole, starting in, you know, grade schools, and also understand that, you know, it's not a bad gene. It's not weakness. It's the condition that is mostly treatable.
One of the things that's very interesting about mental health is, first of all, I always think it's interesting that when we talk about it as if it were separate, as if it were somehow not associated with the body. For example, I hear a lot of people use expressions or phrases like, well, I don't know if this is physical or mental health. And it's interesting because, I mean, I'm not a doctor, but the brain is contained in the body. So mental health is physical health, right? I mean, you've got physical reactions in the brain that are responsible for those symptoms, and people will say, well, is this medical or psychological? And it's like, well, psychological is medical, you know?
correct. And a lot of illnesses, a lot of conditions will affect a person's thoughts, feelings, behavior. Lack of some nutrients can cause you to be anxious, depressed. And in the same hand, some mental illnesses can cause you to feel certain physical, effects as well. So it's, it's not like our head walks alone. Our brain is connected to our system and is what controls every aspect of it. So if there is any, misfiring of, our brain chemistry, it's going to affect every part of our lives, period.
Absolutely.
Right. So there's, and trying to bring about awareness is, as a first step, is really good. That our biology, that what we don't do well with, what causes problems, is when our system is congealed, right? So a lot of anxiety and depression, when you sort of bear down into it, is a congealing of feelings. So the feelings are not getting understood. Feelings are just information. That's really all they are. They're information about who we are, how we feel, what matters to us, what doesn't matter to us, what, there's, what's affected us in often difficult ways that we don't want to feel. And because we have a capacity to repress things, we can repress and create a congealing. Okay, that congealing ends up as the feeling of anxiety or depression, depending on what the feelings are and how a person's nervous system is oriented and other factors. And so when you bring awareness to things, or even better, understanding. So awareness is the first part of it. But then when you actually can break things down and help someone understand personally and directly what's causing the depression, the anxiety. And by the way, people, I don't care who you are, you're going to have periods of that in your life. Knowing how to understand it, think about it, feel the feelings, which allows them to become fluid again. So a healthy system is a fluid system. And so just the beginning of bringing awareness to things, has the potential of moving you towards that. I was listening to a podcast by a neurobiologist, and he was talking about how when there's anxiety, one of the things that is so useful is just walking, just taking a step forward, because it actually triggers to our nervous system and our whole system that we're not in the fight or flight or freeze mode. And so kind of when I listen to kind of reaching out and doing this, I think, okay, let's get out of that mode.
It's such an interesting thing to look at. Something like the mental health system, the psychological health, is that it's very pathology based. And to a certain extent, all treatment, I guess, is about identifying the organ at failure or the problem. On the other hand, one of the things that is interesting is if you said to someone, we're going to take some tests about your heart health, and you've never had a problem with your heart before, and your doctor just said, yeah, you're somebody, we should just take a measure of we test your blood, we test this, we test that. Certain age, we test for prostate cancer or breast cancer. We just do it. We don't say, well, hold on, I don't have cancer health problems, but with mental health, we just identify it based off of a problem, right?
Yeah, but that's what I was saying about the misunderstanding, of, how complex and, how it interplays, between the environment and biological factors. So I think, trying to simplify it and not understanding it is what causes stigma. Even the language we use to describe it, oh, that person is crazy, they're psycho.
Right. It ties very much with what we use as kind of insults or colloquial put downs.
Correct. But that's trying to, simplify something that is, not that simple. And that the root of it could be one or multiple.
And
nothing that describes somebody's, personality or will, of being or not being. It's not something that you say to somebody, get over it.
Yeah. Yeah, you should just walk it off with that heart attack.
Right?
Or even, even the fact, or the fact that you do say walk it off ish, or you do say go for a walk for your heart health. I mean, that's one thing that I think about a lot is we all exist on a spectrum of health, of every kind of health, our heart, our brain, our feet. I don't know. I don't want to show off that I can keep naming body parts, but the fact is we all are on a spectrum, and we understand that usually, but it's like we all have mental health, and to look at it that way and say, we're all on the spectrum of mental health. We're all somewhere. So how do we, I think that's hopefully useful to fight the stigma of saying a mental health problem is a human health problem, is the idea.
I think the other way of fighting it is early intervention, because we are so ashamed of it. Sometimes things are ignored, and not talked about. And that's when, the problem spirals out of control. So I think if we make mental health treatment accessible, and make provide people the education they need, things are not going to get where they are right now, or at least they will stop from, snowballing like they have the last decade. Every part of our society that is affected by, poor mental illness has grown tremendously, from homelessness, addiction, crime. I mean, think about everything that is affecting our society right now. I walk in Los Angeles. I have never seen the amount of mentally ill people just walking down the streets like I see nowadays. It's daily. It's everywhere. It's tragic.
What do we look at as some of the barriers to that? We talk about stigma, but if we're to break that down a little bit and say, what keeps people away? I mean, I know that access to treatment, having a shortage of providers, or often even bad experiences. I know we talk a lot on the show about some of the limitations of some addiction treatments, but that people have bad experiences with something that's not run well, or there are basically a lack. You look at the amount of prescribing psychiatrists that are available who are specialists, that's lower than it used to be. And so for me, that's one thing that leaps to mind for me, is even beyond stigma, is the lack of access to care, had the difficulty in finding care.
Well, and
no doubt.
Yeah.
And I'm sorry, David, even for, you're talking about middle class. So you go see a psychiatrist. We see that over a lot of our patients. Psychiatry and mental illness is something that needs continued care. But if your insurance stops paying after $1,000 or $2,000, you're just going to see that psychiatrist for 2-3 times, and that's it. Mm-hmm. And then the care is over. For those that, can afford insurance, there's just not enough coverage for psychiatric care. That is the basis of everything. It's fundamental that people, have that support. And for those that do not have, health insurance, then is non-existent. So I think there is, the shame of, accepting I have, a mental health issue. And secondly, there is the issue, if I do have a mental health issue, what am I going to do with it? I can't afford to treat it.
Right. That's certainly not always, but more often, the more resources a person or a family have, the better chance they are of getting an effective treatment. And very rarely do people get effective treatments for their problems. And it's not just the insurance or the medical system. It's also finding the right fit, finding and the capacity to sort of really advocate for yourself and pay attention to whether things are getting better or not. And discuss with your clinicians, whether things are resolving, and to be able to sort of have that frame of reference. I think that there's a mode of being in which there's a sense of kind of, we'll just live with whatever's there. And for sure, there's a huge spectrum, right? So, and on top of that, we don't want to know when things are wrong. If usually it takes symptoms that begin to impair our functioning or our lives in such a way that it necessitates seeking out. But, if you can kind of bear it, there's a just a part of just a human part of us that doesn't want to really deal with it until we have to. But, so I think that part of this awareness is, and kind of what we're talking about is it's better. It's, that mental health has to do with changing that whole narrative to this idea of like, okay, we're going to get sick. We're going to have ups and downs and conflicts and deficits throughout our lives and problems with ourselves and others at times. And so what's the best way to manage it? So, the people I see who are the healthiest go to the doctors when that's at the first sign of something, and they get help, with, if they're beginning to, that feels like a depression isn't, is lasting longer than they want, or something else, they get help with it, and it becomes the framework. And I think, when I think of sort of this period of awareness, that should be kind of the hope. And I know there's, like we're all talking about, a lot of factors, including resources, that can make that very difficult.
Yeah, but I think also, David, even the ones with resources, how often do you hear our patients say, when we ask them, do you have a psychiatrist? Well, we're looking for one, but there is a 6-week waiting period for them to see us. How many times do we hear?
All the time. No. Most of the time. In fact, I would say the greatest, the one of the things that happens more often than not by far. And so what happens is people give up, right? It becomes too difficult. They've figured out how to live with themselves and whatever they
think they do.
Right. And so that's exactly right. And so one of the things that is, that I try to do is just literally emphasize about as strongly as I can that you've got to go in and get these things resolved. Otherwise you remain vulnerable, and sometimes it's as simple as as a sleep disorder. I mean, not simple, but that's not simple, but it's, sleep regulates everything. So it can be many things, but yes, I'm so in agreement.
So, again, we are using the May awareness, to talk about it. I think the United States as a country, has so much resources that are being, misdirected to the problems after they become problems, instead of, using our resources for education, prevention, awareness. So we're always, running behind the issue once the issue becomes, tragic to society. So, and now we're trying to fix, the homeless issue, the addiction issue, but the crime issue, but all, withstands from the lack of mental health care.
Well, so one of the psychological dilemmas that impedes in just this is an internal process that I see all the time. So the people, so the part of us, the people need that need taken care of. Babies need taken care of. They're entirely dependent, and they need taken care of. As we grow up, we become increasingly independent, hopefully, and so then there's a part of us that does not want, that feels like in some ways we're being more like a baby when we need help. Okay, so what you see, and one of the reasons that people don't seek help is it evokes a feeling of that helplessness and that dependency. Okay, but what you see in people who have worked out that conflict, they understand that dependency and healthy dependency goes on forever. It never ends. In fact, the strongest people, the healthiest people, have healthy dependency. They have good doctors, they have friends and family and people around them who bring meaning to their lives. They support each other. They talk about things. I mean, there's all kinds of dependency. It's not necessarily correlated or even thought about in that regard, and yet it's the case. So there's a part of our society that has, and I don't think we've known how to talk about it from an internal place because we don't like dependency, right? Because it evokes this feeling of more the baby part of us, which we're supposed to be out of, but it's never true, right? Okay, and the stronger we are, the healthier we are, the more things are getting resolved, the more potential for independence and strength. It goes back and forth. And this is one of the internal conflicts that I talk to people about all the time.
What are some things that Waismann's doing in the group here to help with that promotion, to raise the awareness?
We just put today a press release talking about it. We are daily putting all over social media, facts about mental health. We are sharing resources for available mental health. We are discussing the need, on Twitter and Facebook for additional mental health. So just truly, truly creating education and awareness that I truly believe is the best way of prevention. Mm-hmm. So we're going to use this month, like every day in the morning, we take an hour to put as much information out there as we can.
You got, I know Marina's the one who heads that up, and she helps coordinate the recordings and the podcast here too. She's excellent with that stuff. And I feel like Waismann Method really utilizes social media and announcements very well. Which I mean is honestly one of the things that is useful about that is it's a good example. I find a lot of people struggle to know how to promote and help, if it's like, well, what can I do? Can I be an advocate for my loved one or for myself? And sometimes just sharing something and sharing information or an article or your own story or whatever it is you're willing and able to share online, that makes a huge difference, I think.
Yeah, and I think it makes you as a person, feel good, feel part of the solution. Makes you feel productive some way, somehow, even if it's 10 minutes a day. You are in Quora, you are in Reddit, you are in Twitter, just helping somebody and answer a question of somebody that is, needing that help on that moment, that support. Say help, I would say support, I think is important.
And, speaking of the access to care, it's interesting as I've worked with people myself over the years, sometimes when someone is going through a time where they can't access, they don't have any money, or even when they are accessing treatment, sometimes there's little communities out there, little pockets of communities out there that are able to exist online. There's Reddit, subreddits where people share their story or talk about their own therapeutic experiences. There's a couple of groups out there that are I mean, people are mostly familiar with free resources such as 12-step groups and support groups, but there are harm reduction support groups and cognitive therapy based support groups that are also out there that are available too, that you can find that are low cost to no cost sometimes.
Even NAMI, if you go into NAMI's NAMI website, quite a bit of resources over there, that they partner with from people all over the country.
Yeah.
So,
you guys are partnering up with them, right?
We are. We're just joining anybody that, is willing and ready to make a difference out there. So we're always looking for, people to create more awareness and education. NAMI has been heading through the social media, the Mental Health Awareness Month. I think because we work with addiction as well, and I think David can talk about that, is you can't work with addiction and ignore mental health. It's what we do is a incredibly important part of treatment for those struggling with addiction, but it's just a part of it. We are detoxing them so they are emotionally present to deal with whatever, mental health issues they have. Yeah. So it's a combination of efforts. It's something that we work with every day as well. And I think a lot of people that we work with wouldn't be here if they got the resources and the help they need when they need it.
What are some of your thoughts about that, David?
Clara handles the outreach and that whole part of it. And I'm really more focused on the very specific and individual, work. And so, but they go together. And so, I mean, ultimately the idea is you've got to reach people and help them understand that, there are answers, and then you have to provide them with personal and real ways of understanding what's troubling them that moves their life in a direction that they're needing. And so it's there's two parts to it, and she handles that whole outside part of it, but ultimately, I think the idea that there's an awareness, I only talk, I think, well about it on a more interpersonal way, but they go together.
Well, it's interesting that a long time ago, that we as a society decided that we couldn't, that we were going to treat addiction as separate from mental health, it seems like. And so it became the purview of law enforcement because of the behaviors it provoked, right? And that created sort of a standard of like, well, there's weird behaviors, so we have to have community protection, and then it also demonized. And I think, we could talk about lots of contributing factors to that, but one of the main reasons was that we didn't understand the brain and how it could work. And so we just knew someone's acting a certain way, they're ingesting their, fill in the blank insult, drunk, addict, or whatever it is that we'd throw out as a accusation. And I think we still struggle with those labels and those things, especially with addiction, mental health as well. We have it a lot of times where we say, take someone with a developmental issue or someone on the autism spectrum. Sometimes our definition of health is they should act like everybody else, instead of being like, no, they just need to be mentally healthy. And if they have some personality issues that are not mentally unhealthy, but are a little bit different, the way they approach life, that's okay,
Well, that's right. Right. And so I think the whole framework that addiction is a choice really clouded everything, because it's so much more complicated. And I've used this analogy before. It'd be like holding on to a bar, right? And eventually at some point you could say, well, you made a decision, you chose to let go. And that's true. It's at some level if you're just looking, at some point there's you know, it's true, but addiction is more like the process of letting go, where the tensions just develop at such a level that a decision, it happens, right? So from the disease model, and I think the disease model tried to remedy this in some ways, but I don't think it's perfect either, because we do have to have agency in our life. We do need to know what to trust, and frankly, people do really know when they're making good decisions or bad decisions. But if there's too much tension and the brain is in a haywired, on dealing with a substance, you're not dealing with an even playing field. So like Claire's saying, you have to get them off the substance, get some time in and then you can begin to sort of address the other tensions that lead to sort of unwanted, behaviors.
I think, Dwight, what you were describing before, is the old view of what somebody's struggling, with addiction. I think we have learned on the last 10 years of the opioid crisis that that's not the case. Your aunt, it could be your kid, it could be your brother, it could be your doctor. So it's different, and it's a consequence. It's a consequence of of that exhaustion, of feeling of a certain stress. Like David was saying, it gets to such a point of discomfort with yourself that you start seeking something just to give you a break from that. You know how many parents, when we speak about coming in for treatment, and we ask, is there, was he ever diagnosed with mental health issues? No. There's zero mental health issues. And then as you start talking, oh, he's always been very difficult. No, he never socialized yet. No, yeah, he's easily angered. And they just describe, somebody that has not been able to live, a quality life, period. At least, and my thought is, because the parent will describe how difficult the child is, Now the question is, have you ever stopped and thought, how difficult it is for him to feel this way all the time? Have you ever thought why he's feeling this way all the time? Why is he angry all the time? Why, you know what I'm saying? Is he causing issues all the time? But a lot of people just see it as, they can get over it. They can change it. And they completely ignore the issue. And that's how we end up here.
Yeah, it's interesting how you put it with the idea of early intervention or early identification. And sometimes we want to avoid bad news so badly that we don't want to see it. There's also, it's another old school mentality that touches on addiction, which is medication. Sometimes people are hesitant for medical intervention because they think, well, I don't want my child or I don't want myself to treat my mental health with drugs because drugs are bad. And the interesting thing is that a lot of research indicates that if you're properly medicated or treated, and often therapy and medication go hand in hand, you're a lot less likely to develop self-medication problems, which is interesting.
Right. But I think that comes as well from, so many people were so over-medicated for so long, especially kids, that,
Yes.
People feel a little weary. So again, I think medicine is as good as the ability and the honesty of the doctor that is treating you. Do you know what I'm saying?
Yes, exactly. No, I think, and it goes back to that experience too, of people having bad experiences. There's been, a lot of movement forward in the addiction field and in the mental health field, especially if you go to a professional, person who is trained and has the experiences, that there's a lot of forward momentum in treatment that's changed. And I think there's a generational expectation that ties in with what you said of there might have been, a lot of bad experiences. I know a lot of people that were pushed into, group homes and things that weren't very good when they were youth. And that individual is, number one, maybe more likely to have their children have some genetic vulnerabilities to depression or anxiety, because mood disorders, traits can be inherited that way, and less likely to go get help because they've been betrayed and treated badly and had bad experiences. So that can compound itself.
Well, it's inevitable if you've had it's hard enough to go. It's hard enough to kind of come to terms with things that aren't working. And anyways, that if you've had bad experiences, the desire to avoid people can never sometimes get the treatment they need. And like you're saying, if you get effective treatment and help, your life should get better. In fact, that's kind of the litmus test. And, one of the things I say to the patients I'm working with is build a relationship, and make sure you have confidence. And one of the reasons why one of the core elements of therapy is listening is because the other person knows what's going on and is supposed to, you're supposed to listen. And so because the other person knows himself 10 times better than you do, or you will. So, that's all. So you got to learn.
And we're going to call it there for today. Thank you so much for listening. In this month, as in all months, we would encourage everyone to seek out mental health treatment, seek out addiction treatment from certified and trained professionals who can help you to plan out your recovery. We'd love to hear from you at info@opiates.com or go to opiates.com, our website. We are also on Twitter @opiates. Love to hear if you want to know more about the Waismann method, but if you just have general questions about opioid dependence and things that you just have questions that you'd like us to address on the show, we love to hear from you, and we love to talk about those things. Our music is the song Medical by Clean Mind Sounds. For David Livingston and Claire Waismann, I'm Dwight Hurst. Remember to keep asking questions, because if you ask questions, you can find answers. And if you find answers, you can find hope. Thanks for being here with us on the podcast. We'll be together again soon.